Hi everyone, welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of The Horse. Tonight's event is Endocrine-Related Laminitis, Know Your Foe, and it is brought to you for free by our sponsor, InsulinWise, a supplement from Kentucky Performance Products. Laminitis is a complex and incredibly painful disease of the equine foot. It involves the inflammation and failing of the tissues that attach the coffin bone to the hoof capsule. Without that vital support, the coffin bone can rotate, leading to life-threatening injury. A veterinarian once described laminitis to me by saying that many roads can lead to the same place. That is, laminitis has many causes, from the stress of difficult births in mares to supporting limb failure like that of Barbaro, the racehorse. But another such road to laminitis is endocrine disease, which is specifically what we're going to be talking about tonight. To answer your questions about endocrine-related laminitis, we're joined tonight by Dr. Teresa Burns, who's a board-certified internal medicine specialist with a research interest in equine endocrine disease at the Ohio State University, as well as Dr. Jane Manfredi of Michigan State University, who's board-certified in veterinary surgery and sports medicine. Dr. Manfredi's PhD focused on endocrine disease in horses, and she performed the research involved around InsulinWise, which is our sponsor. Welcome to both of you.
Thank you very much, Michelle. It's a pleasure to be here.
Thank you, Michelle. Very happy to be invited.
Dr. Burns, we're going to start with you. Can you tell us a little bit about your interest in endocrine disease and laminitis specifically?
Sure. I'm happy to let you know how I got here. I sort of became interested in endocrine disease of horses during my residency training in internal medicine, and as a part of my residency training, I went to grad school, and the laboratory that I ended up working in as part of my grad training was that of Jim Belknap, and it was a laminitis research lab. And as a part of my grad training, we sort of melded those two different areas of work, endocrinology and laminitis, and began to focus a bit more on the laminitis that's associated with endocrine disease. And since then, that's sort of been a focus of our work for the last several years. And so that's sort of how I got to be here.
Sure. So from my end of things, I guess my interest was a early burgeoning interest that actually helped get me into vet med totally. So when I was 12, I had a Palomino Welsh pony mare called Chablis, who was very much loved by me and my family. She had a very long curly hair coat and a very crusty neck and tended to be a little bit over-conditioned. And unfortunately, one spring, I went to go and walk her to ride her one day, and she would refuse to move forward. So she was standing in kind of the classic laminitic stance, and as a 12-year-old girl, this was really influential because I was worried about what was happening to my pony. And so thus kind of began the long process for me ultimately going to vet school. During my residency, I liked to work with the endocrinopathic horses, more from the surgery standpoint with looking at treatment, therapeutics, podiatry, and things like that. And so after my surgery residency, I was able to join forces with Dr. Ray Gore at Michigan State, who is an expert with endocrinopathic disease and laminitis, and began my PhD and pursued my PhD with him. Looking at different breed factors and predispositions to laminitis, as well as really evaluating some of the testing and underlying pathophysiology that would predispose horses to laminitis.
So a quick review of our Ask the Horse Live format. We're going to be starting with the questions everyone submitted during registration. If you have a question you'd like to ask live or would like a clarification on a response, you can enter it in the chat window in front of you if you're listening via your browser. We'll do our best to get to as many questions of yours as possible. So with that, let's go ahead and dive in. Our first question is for Dr. Burns. Can you briefly explain to us what laminitis is and how it affects horses, and how specifically endocrine disorders are maybe different than other types of causes of laminitis?
Sure. So laminitis, it's an interesting question, and it actually, it's a disease that we talk about all the time. It almost goes hand in hand with talking about horses. It's so common, but it actually can be somewhat difficult to explain to someone who doesn't stare at horse feed all day, and even to people who do. So laminitis, it's a pretty unique disease, and essentially, the distal limb of the horse is a heavily modified digit, and at the end of it is the hoof capsule, and the hoof capsule is connected to the bony column within the digit by this heavily modified dermal epidermal structure called the digital lamellae. If you were to dissect a foot of a horse, at the subgross and histologic level, this lamellar connection between the coffin bone and the hoof wall sort of looks very similar to very heavily modified Velcro, if you will, to use an analogy. And it looks like that for a reason. It's to really provide a maximum surface area for the attachment between the hoof capsule and the coffin bone to really ensure that that's a strong and durable connection to provide support for the athleticism and weight and power of an animal of this size, to provide that kind of support. So essentially, if you were to try and find an analogy between the end of your digit, your finger, and the end of the horse's digit, if you imagine your fingernail wrapped around the end of your finger, the connection between your fingernail and the nail bed is very analogous to the digital lamellae, which connect the hoof wall to the coffin bone. And so laminitis is the name of the disease that occurs when that connection, the dermis and the epidermis that forms those lamellae, separates, and the connection between the hoof capsule and the coffin bone is disrupted, or in a lot of cases lost in certain areas around the circumference of the hoof capsule. And what happens in that case is the coffin bone and the digital column is destabilized and can essentially rotate or move within the hoof capsule and disrupt the alignment of those things. How it affects horses, it really disrupts the mechanical stability of the digit, for one, and two, it's incredibly painful. It now can be managed as a chronic disease more so than we used to think in the past, and so talking about laminitis now is a bit different than it was 20 years ago, but still it's proven itself to be durably a very difficult disease to treat, even though we know more now than we used to be. It's incredibly common. It's associated with a lot of different diverse disease etiologies in horses, and it represents an incredible both humane and financial burden to the equine industry around the world, and so it's a very important disease of horses. We know a lot more now than we used to, but there's aspects of it that are still quite mysterious, unfortunately.
Yeah, I, like Dr. Manfredi, had that pony that had laminitis as a kid, and that was the end of the road at that time. So it's fortunate that we have researchers like you two who are looking for ways to help manage these horses and keep them going longer. Dr. Manfredi, our next question is for you. It's from Chantel in Quebec, Canada. She wants to know if you could differentiate between insulin resistance and metabolic syndrome. And I would ask, while we're covering those two topics, if you could throw in PPID as well.
Sure, that's a great question. So there's a lot of confusion around a lot of the terms we use to talk about causes of endocrinopathic laminitis. And so the two main causes are equine metabolic syndrome and PPID, or pars pituitary intermediary dysfunction. Okay, so just let's talk about the metabolic syndrome first. And with that, I'm going to get into the insulin resistance, because insulin resistance is actually kind of one of the characteristics associated with it. So metabolic syndrome in horses is characterized generally by obesity or what we call regional adiposity. So either your horse or animal tends to generally be overweight / obese, and then regional adiposity means if you've ever seen, like I was referring to my pony who had that very crusty, tall, fatty neck, but they could also have fat in other places, such as over their ribs, by their shoulder, by their tail head. And also we now know a lot of the times there's extra fat by their organs inside as well. In addition to that, we obviously know horses that have metabolic syndrome have a predisposition to laminitis. And then kind of the final two characteristics that are associated with this syndrome is this idea of insulin resistance, and then kind of a newer term, which I'll also talk about, is insulin dysregulation. So to talk about insulin resistance, let's talk a little bit about insulin. So insulin's a hormone that is normally involved in regulating glucose or sugar levels in the blood and tissues of the body. So when horses eat a meal, whether it's grass or grain or hay, they will secrete insulin from the pancreas into the bloodstream. And then that insulin tells the tissues of the body to take up this sugar. Okay. So the problem with insulin resistance is when that is not working. So basically you need a lot more insulin to take up the same amount of sugar into the tissues. Okay. So the new term that we are kind of using more commonly now, because diagnosing a tissue level problem is something that's more difficult and takes kind of more extensive testing than what we're normally doing in the field, is a term called insulin dysregulation. And what that is implying is that, again, there's this disconnect between the level of insulin you need with your glucose levels. So for example, you might have a normal amount of glucose, but your insulin levels are really, really high, either just resting at baseline in the morning, and in some of these horses, after a meal, they go sky high in response to the meal itself, which again, not something that should normally happen. So when you're talking about metabolic syndrome, again, that encompasses this idea of insulin resistance or dysregulation, typically looking at either a fat horse or one that has localized fat deposits, and this predisposition to laminitis. So the second part, which is a great question to bring up, Michelle, was, so what's PPID then? And so when we're talking about PPID, it's actually a different endocrine condition, which is basically kind of like a benign tumor, a part of the pars pituitary. As a result of that, we actually kind of lose some of our dopamine inhibition on that area. And so the end result of this can be the horse that I was talking about that is like that curly, hairy coat that doesn't shed out in the springtime, that has muscle wasting, especially over the top line. They can also often urinate and drink a lot more than you would think, so the stall will be covered with wet urine in the morning. And they'll have predisposition to like dental disease because they're generally immunosuppressed. And so these animals can also be predisposed to laminitis. And like my poor pony Charlie, sometimes horses can have both. And that's kind of a double whammy, we think, where they each exaggerate the other and probably make things worse. So hopefully that explains a little bit about the two main conditions that we think of when we think of endocrinopathic laminitis, and also talk a little bit about how each of those is a little different.
Okay. Thank you, Dr. Manfredi. And Dr. Burns, our next question is for you. It's from Kaya Lucia in Eugene, Oregon, and she wants to know if you could address how a blood test is read to determine a horse's risk, and also the ways that blood tests can vary in how they're performed or in results. Dr. Burns?
Sure. So this is a really good question, of course, that really gets to the heart of how we would go about trying to identify horses that have insulin dysregulation for the purpose, hopefully, of trying to manage that and prevent them from experiencing bouts of laminitis in the future. So some of the common blood tests that you'll see performed on horses at risk, and Dr. Manfredi, as part of her research, has actually done quite extensive work on a couple of these. One of the ones that you'll see first would be a basal insulin concentration, and that simply is assessing the insulin concentration in a single blood sample, usually after some sort of dietary preparation of the horse. There's a little bit of conversation happening now about what's the best dietary preparation, i.e., should the horse be fasted for some period of time? Should the horse have grain withheld? I think most people do agree that concentrate feeds, which tend to be higher in non-structural carbohydrates, those sugars, starches, and fructans that can increase insulin secretion, those types of feeds should be withheld for a period of time, usually 10 to 12 hours or overnight. And then the animal offered some low non-structural carbohydrate hay overnight and have feed pulled 2 hours before. That's a pretty common dietary preparation recommendation. However, there's some folks that are suggesting that it might be more useful to assess the horse's insulin concentration under conditions under which it's typically managed. So if the horse lives on pasture, then identifying what its basal insulin concentration is at some average time on pasture might be useful at assessing its risk. Evaluating its insulin when it's eating its typical diet of grass, hay under conditions in which it's usually fed might be useful. So anyways, probably the most important thing, given that variability in test conditions, would be if this is a value that's going to be used to both diagnose the horse and to evaluate it over time, the conditions under which the sample is collected should hopefully be standardized. So for example, if you choose to have your horse evaluated at pasture, the next time that it's evaluated as a follow-up sample to assess whether there's been some improvement, the testing conditions should be as similar as possible. And understanding there's a lot of variables to try and manage here. Some of the variables involved that might influence an insulin concentration can vary with time of day. They can vary with season. They can vary with fed state of the horse, obviously. They can vary with a lot of things. And so it's not going to be perfect, but trying to be as consistent as possible is important. The vast majority of horses that haven't received concentrate feed in the last 3 to 5 hours that don't have insulin dysregulation will have an insulin concentration in the single digits. Typically, less than 20 milli-international units per liter is a pretty typical cutoff for most labs that run these with most different testing platforms. But realistically speaking, many normal horses will have concentrations far lower than that. So if you're interpreting a basal insulin, less than 20 would be considered normal. Many labs will consider 20 to 50 milli-international units per liter to be a gray zone, although I think a lot of people would make the case that there's not very many normal horses that are going to be in that range, and so I'd be concerned there. And then greater than 50, according to the Equine Endocrinology group, their recommendations are housed at Tufts. It would be considered to be consistent with a diagnosis of insulin dysregulation. Other tests that utilize insulin concentrations as part of the test, like the oral sugar test, and again, I hope Dr. Manfredi will comment on her experience with this because she's done a lot of them. Oral sugar test essentially puts a little stress to the system, gives the horse some oral carbohydrate and sees what their insulin response to that is. You might see veterinarians talk about a combined glucose and insulin test. You might see people talk about an insulin tolerance test. These are all tests that can be used to try and identify various facets of insulin dysregulation, and they all have different pros and cons, and some of them can be used in series or multiple tests to identify different abnormalities in the same horse. I'll just leave with one additional comment about a basal insulin, and that it's poorly sensitive, meaning we have lots of horses that have very abnormal, that are very insulin dysregulated, that can have a normal basal insulin. So while if it's high, if you measure a high sample in a horse, that's consistent with the diagnosis of ID. If it's normal, it doesn't rule it out. So if it's a high-risk horse or a horse that you're very suspicious has a problem, and they have a normal insulin, then we'd follow up with a dynamic test to try and get a little bit more sensitive information about that horse's problem.
Dr. Manfredi, did you have anything that you wanted to add?
Yeah, a few things. So following up on that, just to kind of drive the point home, because one of the biggest questions I get is, individuals is like, oh, the insulin was normal on the basal, but, my horse is still having issues with founder and laminitis. And so just to give you some numbers, so if you tested 100 horses and you knew 20 horses for sure 100% had insulin dysregulation issues. So we did a gold standard test on them during my PhD, and we knew that they had it. If you just looked at their basal samples, I would have only found 1 out of the 20 horses as having a problem. So I would have missed 19 horses that were at risk for foundering by just pulling that basal static sample. Versus when I was doing the oral sugar tests on these horses, I was able to identify 18 of the 20 as having a problem. So I'm hoping that can help drive home the point to everyone listening that basal samples are really not a great step for determining some of the insulin dysregulation statuses of horses. That's just not sufficient anymore. If you're lucky and you pull it and it's high, exactly, I totally agree with you, Teresa. Dr. Burns said, yes, this animal has a problem, but there's so many of them that won't register as being high that really are at risk. And so, and one other thing, when you're talking about variables and with testing and keeping things consistent, one thing that I didn't actually realize until actually going through some of my PhD work was consistency between labs. So if you're pulling your samples, whether you're running a static test or a dynamic test, if you are sending them to Cornell, keep sending them to Cornell. If you're sending them to us at Michigan State, which I would love, keep sending them to us. And that's because there's some variability with the actual test they use to measure insulin in some instances, and there's some variability between labs. So again, it's one of the factors that can kind of influence your results is keep it going to the same laboratory as possible. Yeah, as far as I can definitely go into more of the testing and breed specific things. If Michelle, you think that is the next question that you'd like to address?
Yeah, we have some questions that are coming in from the live audience, not necessarily related to testing, although I'm expecting we'll get some follow-up questions here pretty quickly. But I do have a question, Dr. Manfredi, about donkeys. Sarah is in our live audience, and she wants to know if laminitis in donkeys is any different than laminitis in horses and ponies.
So donkeys definitely have this as a problem. It's definitely an issue with them across the board. The donkeys that I have dealt with, it tends to be, they're actually, at least the ones in my practice, have been hardier than the ponies and the horses in a way that sometimes they have a more severe change of their coffin bone, but they're still getting around a little bit better. And that potentially I think that might be because they're typically lighter than some of our ponies and horses that have the problem. We do have to kind of go after them more aggressively, I think, with like farrier care and what you're going to be doing with trimming their feet and taking care of them. And I guess as far as testing, we actually have some recent studies that have gone about looking at some of the basal and dynamic testing results with donkeys. So your veterinarians can refer and look at those to get a better indication about where your donkey is standing. Because I guess, one of the other parts of my work has shown that breed differences can actually influence insulin levels and have an effect. And so you're testing, we have these cutoffs that, Dr. Burns talked about before, but I would say in breeds that are more predisposed, such as your Welsh ponies and your donkeys, the insulin levels where you would say, yes, this is truly a problem, is more like down to the 30 and 32 mark versus up at the 50 mark. So I guess, Dr. Burns, what other thoughts do you have on donkeys for issues with laminitis, endocrinopathically related?
Sure. I agree with absolutely everything that you just said. Particularly, I was thinking when this question was first asked, I was like, oh gosh, the first thing to, certainly donkeys get laminitic. We see, I would say in our practice, if we are looking for clinical evidence of laminitis in donkeys, we find it in more often than not, even in ones that are where the disease is so they're relatively sound. We can see divergent growth rings. If we take rads, they almost always have some kind of change in there, but they're so stoic that they don't show us very much in the way of clinical disease. And so I think it's quite common. The issue then becomes with trying to find, and I love that you brought up the reference range things. One of the faculty members here at Ohio State, Ramiro Toribio, has actually done some work with some groups in Europe trying to develop reference ranges for some of these both diagnostic tests and for things like triglyceride concentrations, insulin concentrations, et cetera, in donkeys, because it does appear to be different in them. So they seem to be more have higher peripheral tissue insulin resistance than horses do. They are a different species. Their fasting endogenous triglyceride concentrations are higher. And so we don't, it's nice that we do have those papers that you just mentioned to validate some test points in donkeys. We probably need some more, and some of these reference ranges that we use for things that we measure routinely in horses probably need to be altered in donkeys, because it does appear that they are different. So indeed they are different species, and it's just, it's pretty common, but some of the rules don't necessarily apply in the exact same way as they do in horses.
We have another question from our live audience, Dr. Manfredi, that's breed specific. Sandy wants to know if Andalusians are more prone to developing laminitis, and is it often thyroid related?
So yes, there's been a lot of elegant studies that have looked at the Andalusian breed and shown that they are more predisposed to laminitis, so they are one of the more at-risk breeds. And so the second part of the question was, is it thyroid related, if I remember?
Yes.
So the thyroid is one of those interesting things in horses, because I think at least initially we were thinking a lot of the animals that had metabolic syndrome were hypothyroid, but I think the general consensus now, and I will see if Dr. Burns agrees with me, is that it's very rare to actually have a true hypothyroid horse. There are some rare instances of hyperthyroid, but we really truly are not seeing a lot of hypothyroid horses. Although one of the things that was used early on for these horses that have metabolic syndrome is Thyro-L or levothyroxine, which is a treatment for hypothyroidism. And people, I think, were seeing some initial effect, potentially because it increased the metabolic rate of these horses, and they had some weight loss, which we know losing weight can help your insulin sensitivity. So yes, Andalusians are predisposed as a breed to laminitis and endocrinopathic issues with insulin regulation, but it's probably not the thyroid as the driving cause of it.
Dr. Manfredi, are there any other breeds, and you mentioned Welsh ponies, are there any others that are more prone to endocrine-related laminitis?
Sure. So Welsh ponies, Arabians, Morgan, Tennessee walking horses, Pasafinos, generally ponies in general, not just the Welsh ponies. And then the breeds like the Andalusians and some of the pre-breeds as well are more at risk. I will say that in some places you see quarter horses on that list, and I will say my research, at least here in the United States, did not really, those were some of the most insulin sensitive horses we tested. Standardbreds, again, are lower at risk, and your thoroughbreds and some of your warmbloods, again, tend to be a little bit lower at risk. So if you had to pick a horse that wasn't going to have a problem, typically a standardbred plus or minus your quarter horses would be the ones you would be looking at, whereas Michigan State has a breeding operation for Arabians here, so it keeps me very busy sometimes.
Mm-hmm. Our next question is for Dr. Burns, and it's from Mary in Springdale, Washington. And Mary wants to know, why does insulin resistance cause laminitis?
Well, I would answer to Mary that I would also like to know why insulin resistance causes laminitis. There has been an incredible amount of research effort poured into this very question pretty much ever since we first started to observe that some of these endocrine issues were associated with laminitis in horses. And, we've come a long way in 10 years, and we've sort of started to distill down some of the important research questions. But at the end of the day, just a bit of a spoiler alert for you, Mary, we don't know exactly how insulin dysregulation causes laminitis, but some points that are under investigation. So we know that, as Dr. Manfredi explained earlier, insulin is really important for glucose disposal, and primarily the tissues that take up glucose in response to insulin are the primary insulin responsive tissues. So the skeletal muscle, the liver, and the adipose tissue. All of these tissues that need to respond to insulin express a receptor on their cells that lets it see that insulin. So insulin binds its receptor, and then the downstream effects of that occur. The digital lamellae, that structure that I described earlier that provides that sort of Velcro connection between the hoof capsule and the coffin bone, those cells in there are very analogous to the cells in your skin. It's essentially, as I mentioned earlier, it's a very heavily modified fingernail. You can think of it that way. And those cells in that heavily modified skin appendage are not insulin responsive. So we know that those cells in there, they need a lot of glucose to maintain that connection between the hoof capsule and the coffin bone. They're doing a lot of work. They use a lot of sugar, but they don't need insulin to take it up. And so they're glucose or they're insulin independent. And so we know that if we take a horse or a pony, and it's interesting that Dr. Manfredi mentioned standardbreds earlier, and that's our experience too, that quarter horses, standardbreds, thoroughbreds, while we certainly see the odd case of insulin dysregulation in those breeds, they seem to be at some level sort of genetically protected against some of these diseases. But it's sort of unfortunate that a lot of the really landmark studies in this field have been done with standardbred horses. They're sort of the workhorse of laminitis research. Mm-hmm. And, you know, for laminitis that's associated with sepsis or for support limb laminitis, that's probably perfectly appropriate, and maybe we can extrapolate a lot from them. But it's sort of a limitation of some of this work that a lot of these things are being done in standardbreds. And so people are recognizing that and trying to modify their approach somewhat. We know that if we take a standardbred horse and we infuse insulin in their blood for 3 days or so, 48 hours, 72 hours, to very high levels. So instead of 20 millinternational units per liter, if we make it 1,100 for 3 days, we can make that horse laminitic. Why that is a bit unclear. It doesn't appear to be that insulin signals directly to those skin cells, those keratinocytes in the lamellae. There seems to be some sort of an intermediary between those two, and it actually might be glucose. Along with all of that insulin that has to be infused into a horse for this model, in order to keep their blood sugar at a relatively normal level, we have to infuse a lot of glucose as well. And because the lamellae are not insulin dependent, they continue to take up glucose quite readily if we infuse it at a high level. And so we don't know exactly why IR causes laminitis, but there's lots and lots of studies that suggest that the higher a horse's insulin is, both either at baseline or in response to some sort of glucose challenge, either an oral sugar test, a change in their diet to a high non-structural carbohydrate feed, that's a pretty strong, probably the strongest risk factor for endocrinopathic laminitis that we know of in horses. So we're still trying to tease out the details here, and there's a lot more work to be done, but it really is it's a pretty robust correlation at the moment.
Our next question is for Dr. Manfredi. It's from Mary in our live audience. So we've had some mentions of quarter horses and quarter horses not being the ones that are necessarily going to have this form of laminitis. But Mary has a quarter horse who is laminitic. She says the mare isn't overweight and she's turned out on minimal grass. Her laminitis tends to flare up in late February and early March. Could it be seasonally or hormonally related?
Sure, and that's a great question. And it's funny, I'm actually interested because a lot of these, what we call like winter laminitis cases, like these are where I've seen the quarter horses have problems. And so we can talk about that in a little bit. But what we do know about some of these like winter laminitis cases is that some recent work out of Kentucky has shown that our insulin levels, our horses' insulin levels, are generally the highest in spring, which many of us could predict. But the next place where they're high is actually in winter. So spring and winter are the times where just even basal levels or levels of insulin in response to like an oral sugar test are highest in spring and winter. So what we can have there is, if we are working off the hypothesis that the high level of insulin, whether it's insulin herself or insulin related to glucose as being a problem, it would make sense that we actually do see spring and winter laminitis occur. So seasonally, there's definitely effects. Late summer is a safer time period as an early fall as far as what insulin concentrations are there in response to a challenge. And so with quarter horses, what I would say, and what I'm trying to actually interested in finding kind of a number of quarter horses that have this problem, but we know that a lot of the quarter horses actually are very much more well-muscled animals. So if you think about some of your halter types, they're definitely have they're the muscle horses of the world, shall we say. And quarter horses actually have this genotype which promotes this muscle development because there's a lack of inhibition of that muscle development. And it's called a sign insertion. And so what I'm curious about in some of these horses is that I think that the very well-muscled horses actually are protected because the more muscles you have, the more glucose you use, and it's one of the greatest places for like insulin dispersal and glucose dispersal. And some other quarter horses that have the laminitic problem, I'm wondering if they actually don't have this particular genotype. And so if they don't have it, it's not protective, and then they're perhaps more at risk. So one of my baby interests would be to try and gather up some blood or hair from some of these quarter horses that have these repeated bouts of winter laminitis and see if actually they are genotypically not as safe as other quarter horses.
Interesting. We have another question for our live audience. I'm going to give this one to Dr. Burns. Callie wants to know if you can explain how inflammation is involved in laminitis.
Oh dear. So, how inflammation is involved in laminitis? Well, this is something that people have been very interested in for a long time, because you might recognize there are a lot of anti-inflammatory medications on the market for lots of species, including horses. And so it would be really nice if we could identify a reliably treatable inflammatory component to laminitis in horses. And so in this sense, we would probably have to now start to divide laminitis into the disease associated with different etiologies. So there's three primary forms of laminitis in horses. There's sepsis-associated laminitis, which is the type of laminitis that horses with diarrhea or horses with pneumonia or mares who retain their placenta, those are the ones that get sepsis-related laminitis. And there's a really strongly described role for inflammation in that lamellar tissue, in the lamellar attachment, in sepsis-associated laminitis. It's very, very inflammatory. So in experimental models of that condition, you can see white blood cells, those sort of first-line soldiers of the immune system, really invading the lamellae within about a day or two of inducing experimental laminitis. It's a very inflammatory type of the disease. In support limb laminitis, the type of laminitis that Barbaro infamously succumbed to, inflammation is probably involved, but it's a little bit less well characterized, and there's not a well-established experimental model of that condition. With endocrinopathic laminitis, which is what we're talking about here tonight, the laminitis that's associated with EMS, with PPID, with steroid administration for horses, the role of inflammation in the feet, in the lamellae themselves, is much less well defined, and there's sort of conflicting information on this. In some experimental models of endocrinopathic laminitis, there's very little evidence of inflammation within the feet. So there's not very many white cells in the lamellae. If we try and measure some proteins that are produced in inflammation in that setting of that disease, there's not very much there. And so with respect to inflammation, it appears there are differences between the different types of laminitis. Although at the end of the day, it actually might not matter too much from a preventive standpoint, because even in the very inflammatory form of sepsis-associated laminitis, giving anti-inflammatory drugs like bute or banamine or steroidal anti-inflammatories like corticosteroids doesn't seem to be effective at preventing the problem. Those drugs, however, are pretty important because they're very useful pain medications for horses with laminitis of any form, and we know that this is can be an excruciatingly painful condition for horses, and so those drugs have an important role there, but perhaps not in actually modifying the course of the laminitis itself, if that makes sense.
Our next question is for Dr. Manfredi. It's from our live audience. Allie says that she's heard that some horses with equine metabolic syndrome aren't overweight. Are these average weight or maybe even thin horses still at risk for laminitis?
Absolutely, yes. So that's a great thing to bring up. When I was talking about our classic definition of EMS before, when we talked about horses that are overweight or have regional adiposity. two things can happen here. So one, you could have a horse that is totally a regular body condition score and doesn't have regional areas of fat like the crest, neck, and tail head. They can look completely what you would say a normal horse, but yet these are still animals that when we do dynamic testing on them, we can pick out that they're at risk based on their insulin responses to challenge. So there are also horses, one of my favorite research horses here on the Arabian farm is Sandman, who has a body condition score about 4 all the time. So you can see his ribs a little bit more easily, but he has a very, very cresty neck and tail. So if you were going to body condition score him, it'd be a little bit hard because he's so thin. You can, he's not so thin. You can see his ribs, but yet he has kind of these regional fat pockets. So we absolutely do have horses that are what you would consider thin that have insulin dysregulation. And they're actually some of the ones where I am most concerned because where clinically I see it is that no one is thinking or worrying about laminitis with them, and all of a sudden their feet are sore and it's a problem. So a lot of us, if we have our, very well-conditioned Welsh ponies, are really in tune with this is maybe an animal that could have a problem on the spring grass. But if you have, a really fit Morgan, you wouldn't maybe necessarily think twice. And so here's where with animals that, if they already have a breed predisposition to it, I do like to test these animals to kind of see where they are, because it could be that you're doing everything right management-wise. So you're keeping the weight off of them. They're getting regular exercise. They're on a, low non-structural carbohydrate diet. And if you test them, they may look okay. But if you take away one of those good management features, all of a sudden you might start developing problems. So absolutely, just because your horse is thin does not mean they're safe from having problems. You really need to test and see.
So, Dr. Manfredi, does that mean that the testing should be part of your regular preventative wellness care for your horse?
So if you have a horse from one of the breeds that we talked about that's more at risk, I would actually include that as a feature of something I would like to do on a yearly or bi-yearly basis. So if you're talking about Arabians, Morgans, Passos, any of those breeds, that is something I do incorporate or talk about at my yearly wellness exams about something that we consider testing to kind of know what that horse's status is, and then to be able to watch over time to make sure we're not going to start developing a problem.
Okay. Dr. Burns, we have a question from Rachel in our live audience. She says that she has a horse that has rings around his hoof wall. She wants to know if that means if he's definitely had laminitis in the past.
That's another very, very good question. So what's the significance of growth rings in the feet? And in this setting, I think it's important to remember that horses can develop rings, visible rings in their hoof capsules for a lot of different reasons. Sometimes major medical illness can cause a detectable change in a growth ring. Sometimes a change in feed can cause it. But the key with looking for external evidence of previous bouts of laminitis is looking for something that we call divergent growth rings. And what that means is that if you're looking at the horse's foot from the side, if you're looking at growth rings going from the heels, progressing over to the dorsum of the foot to the toe, the rings will be spaced wider apart at the heels, and they narrow towards the dorsum or the top of the foot. And that is very characteristic of laminitis. And so other things that you might notice might be a little bit of a divot at the top of the foot. You also might notice that there might be a little bit of a dorsal concavity to the hoof capsule. If you pick the foot up, you might notice that the sole is flat, or that the sole is convex or rounded or bulging. You might notice that the white line is widened. These are all little bits of evidence that you can get just from looking at the outside of the foot, that there might be some historical evidence of laminitis. And so if we see that, even if it's a horse that we've never seen before, and even if they're walking perfectly soundly, they have a gait that looks normal, it might not be a bad idea to go ahead and get some foot x-rays on a case like that, because I wouldn't say you'd be surprised if you saw that external evidence, but the degree of change in the foot might surprise you, particularly when we're talking about these endocrinopathic cases. where the disease can actually be a very chronic, smoldering, somewhat occult kind of a problem. In comparing it with sepsis-associated laminitis, which tends to be fulminant, acute, very severe in nature, and sometimes catastrophic in the way it causes disruption of the foot, endocrinopathic disease, it can be severe and acute in some instances, but probably what's more typical is that it is insidious and chronic and smoldering, and you may get a horse that we get a lot of horses that we see that, and I think this is probably the case for lots of people, that come in with a history of having some stiffness or arthritis that tends to be seasonal or only when they're turned out on pasture. And honestly, that happened a lot more before awareness was improved about laminitis. We had a lot of seasonal arthritis that happened about 10 years ago, and now I think people are a little bit more savvy about recognizing that as laminitis in these cases, because sometimes if that's noted and a single dose of bute or banamine or your whatever NSAID is that it was given, those horses often look a lot better the next day, and that's very typical for a lot of cases of endocrinopathic laminitis. So there's a bit of a difference there between the two. But looking at the morphology of the feet and listening to sometimes what your blacksmith is saying about the changes that they're noticing in the feet over trimming cycles can be very useful for detecting some of these occult pathologies before the horse actually even develops any lameness, believe it or not.
So, Dr. Burns, if you were doing a pre-purchase on a horse, would there be any evidence that the horse had laminitis in the past?
Sure. So if we're doing a pre-purchase exam, those very same changes, we would look for them and note them. And perhaps, other components of the pre-purchase exam, like jogging, inflections, et cetera, might dictate that you would take radiographs of certain pieces of the horse's anatomy. Well, if we saw changes like that, divergent growth rings, dorsal concavity of the hoof capsule, drop sole, we'd recommend getting foot rads. And then we actually might recommend, as I can't remember if Dr. Manfredi mentioned this or not, I thought she did, but do some lab work, some endocrine testing based on what those feet look like. That certainly might be added to a pre-purchase exam based on what the horse looked like at the time of its exam.
Dr. Manfredi, we received a lot of questions about some supplements for managing insulin resistance and equine metabolic syndrome. Renee in Mountain Iron, Minnesota wants to know what to look for in an effective supplement for horses with insulin resistance. This is an area that you've studied. What advice do you have?
Sure. So the first thing I would tell Renee or tell anyone is that supplements are supposed to be just that, they are supplements to other management changes. So you can't turn your horse that's at risk for this out on spring pasture. You can't give them a ton of grain. You need to be doing the dietary and preferentially exercise management too. And these supplements that we're going to talk about are to be on top of that to help kind of give that horse a little extra protective edge, or help hopefully regulate the insulin a little bit better beyond what those dietary and exercise management changes are doing. So kind of the two older supplements or drugs that people would use to kind of help with EMS or metformin, and then the Thyro-L or the levothyroxine. And so with those, basically, obviously we saw some mixed results. So a lot of the times with the metformin, we saw studies that showed it had really poor absorption, but some studies showed that we did blunt the glucose response a little bit, which in turn could decrease the insulin response the horses had. So metformin potentially is advocated to kind of give ideally immediately before going out to graze. There's a recent paper that's actually looking at giving metformin along with another drug, which sitagliptin. I will say I can't probably pronounce that correctly, but that's really, really new, saying that those two together perhaps might be more effective than the metformin alone, and it might help with the absorption of metformin. So I guess in response to that, most of us will say that's something we can try, but it's not been overly impressive in all animals. So when looking at the Thyro-L, again, that was initiated because people thought the horses were initially hypothyroid, and it probably increases the metabolic function of the animal and thus loses weight that way. So again, that has kind of mixed results, and it's something that we don't want the horses to be on long term. There's a concern about cardiac issues, although I will say clinically I haven't really seen that. Perhaps there's been a few horses where I've been wondering about their atrial fibrillation, but I don't think there's been enough numbers to prove that. So kind of other options for supplementation, obviously, again, just kind of acknowledging some of the work that I have done with resveratrol, or insulin-wise, that has not only resveratrol, but also quercetin and some amino acids like lysine and leucine. Others have looked at resveratrol by itself for influencing both joint and metabolic health. And so in the study that I did was looking at 15 horses that we knew from previous testing or multiple previous testings to have actually insulin dysregulation. We started to feed them the insulin-wise over the course of 6 weeks, and we're able to see in 10 of the 15 improvements in their insulin dynamics as well as their adiponectin. So with any of these, again, it's important to recognize there were 5 horses, that 3 Arabians and 2 Morgans, that were just very insulin dysregulated to begin with, and we weren't able to lower their basal or tested insulin values. But for a large 10 of the 15, we were able to help them out quite a bit in lowering their insulin responses to the testing, and also have increased weight loss. And so with resveratrol, from whatever source you're talking about, potentially we think it actually activates the mitochondria through a SIRT1 pathway. So the mitochondria are kind of like the energy powerhouses of the cell. And so if you have a more active metabolism, that's theoretically helpful as far as your processing for insulin and glucose. And additionally, with insulin-wise, we've added in some of the amino acids, the lysine and the leucine, which have been shown to have like an additive effect when given with resveratrol, as far as helping with weight loss in some animals. And so resveratrol on the whole has also been shown to kind of alter the microbiome. And I'm working on that currently to see if we can see some of these microbiome changes in the animals, looking at some of their feces before and after we supplemented. And why that's important is because we think that the gut in these EMS horses is really important because it secretes incretins, which can influence the levels of insulin that you develop. And ultimately, a lot of your microbiome can also weigh into this as well. And so we know in EMS horses from some work done down in Florida and by Pat Harris that their microbiome is very different and more restricted than normal horses. And so if we could potentially influence the microbiome to be a healthier, more diverse population, we could be trying to get at the heart of the issues that we're seeing. So again, metformin, the Thyro-L, resveratrol, plus or minus amino acids are some of the more popular supplementations or drugs that people have tried. I will say that there is a new glucose cotransport inhibitor called veliglifloxin. And again, please forgive me for probably not pronouncing that completely correctly. That's been given orally in some horses to prevent some of this glucose reabsorption. And it potentially might be an up-and-coming other supplement to look at for influencing or helping horses that have these dramatic insulin responses despite other management changes. So I guess I don't know what other questions you might prompt from that, and I'm happy to take them.
Okay, Dr. Burns, our next question is for you. It's from Caroline in Chico, California, and she wants to know what kind of diet is appropriate for a horse that's at risk for this type of laminitis.
Sure. So this nutrition is one of the first lines of therapy for a horse that has insulin dysregulation and EMS and endocrinopathic laminitis. And the overarching goals of treating a horse with these conditions nutritionally, if they are overconditioned or overweight, nutrition is very important for allowing them to achieve a more normal body condition. That often, particularly in genetically predisposed breed seems to really improve their insulin and glucose dynamics tremendously. But as Dr. Manfredi alluded to earlier, in genetically predisposed individuals of these predisposed breeds, sometimes they can be quite lean. And so the other goal of treating horses with endocrinopathic laminitis nutritionally is to decrease their insulin response to the diet that they're fed. And so a way that this can be done is to both minimize the content of non-structural carbohydrate, those sugars and starches and fructans in the diet. So things that can be done to try and accomplish that goal would be to minimize the amount of concentrate feed in the horse's diet. And that includes both grains, cereal grains, which seems like that's the low-hanging fruit. I think people understand the risk associated with that. But certainly some extruded and pelleted and forage-based concentrate feeds, particularly ones that are molassed, can sometimes have a bit of a sneaky amount of non-structural carbohydrate in them. And as far as a number that you'd be looking for to try and target with the diet, this hasn't been looked at and analyzed with an awful lot of rigor, but it's been used as a pretty common rule of thumb for a long time by a lot of people. And based on a giant mountain of anecdote, it seems that 10% of non-structural carbohydrate on a dry matter basis in the diet appears to be a reasonable target. And so that's including the forage component of the diet, and any supplements or concentrate feed that the horse might get should ideally be less than 10% non-structural carbohydrate. So most horses should be fed somewhere between 1.5% and 2.5% of their body weight in forage per day. Ideally, that forage should be less than 10% NSC, and if it's higher than that, and this is a pretty common question that we get, people will usually ask about soaking, because often what happens is people either prepare or buy a lot of hay and hopefully have it tested, and then it comes back that it has 18 or 22% NSC, and they say, oh gosh, I just bought a lot. What do I have to do with this? And so it turns out that soaking can be an effective way to get some of the water-soluble carbohydrate out of a high NSC hay. It can decrease it by about 25%, and there's a couple of different studies that have shown that that's a pretty reliable number. So if you've got a hay that's about 18%, it can actually get it pretty close to a level that's safer for a horse with EMS. If you have a hay that's 25% or 26%, and those certainly exist, it probably isn't going to get it down to where it needs to be for a horse with insulin dysregulation. So that's just something to keep in mind with respect to soaking. But at the end of the day, the goals for nutritionally managing a horse with insulin dysregulation would be to make sure that the content of the feed is low NSC, and that they have a little bit of feed going in all the time. So even if a feed has a little bit higher NSC content, so let's just say it's 15-18%, if it's a small amount of it fed multiple times per day, that's another strategy that can be used to minimize the amount of increase in blood sugar after eating it, and therefore minimize the amount of insulin that's secreted in response to that meal. So these are all strategies that can be used that are appropriate for insulin dysregulation in the setting of EMS and in the setting of PPID that we were talking about earlier. So the same diets actually would usually be very appropriate for both situations.
And we only have about a minute left in our live broadcast and our official time, but I want to follow up really quickly with that. What about exercise as part of the management strategy along with diet?
Is this for me or Dr. Burns or any of us?
For Dr. Burns.
Oh, very good. So exercise, and this can be about a minute's worth of point here. Exercise is critically important, and for a couple of reasons. One, it's important over the long term for maintaining ideal body condition, but in other species, and there's a little bit of work in horses to suggest that even in the absence of even in the absence of the loss of a single ounce of fat, a bout of aerobic exercise that's vigorous. So for a horse, this would be 30 minutes of trot and canter, 3 to 5 times a week. After a single bout of that, you can actually detect about 4 hours of sustained increase in peripheral insulin sensitivity. So even in the absence of weight loss, which is good for horses that are over-conditioned, they should have that too. But even if they don't lose any weight, exercise in and of itself can improve insulin sensitivity and minimize insulin dysregulation. And it turns out that some of the same pathways that are activated by resveratrol and metformin and some other targets like aspirin and some other things are the same pathways that are activated much less expensively, or much less with much less financial involvement in wailing and gnashing of teeth of medicating horses by exercise. And so as long as horses are sound enough to do the work, which is a big question for when we're talking about laminitis patients, as long as they're sound enough to do the work, exercise is a really important and often undersung part of the management of horses with endocrine disease, particularly if they happen to be overweight.
So
can I add one thing just really quickly?
Yes.
Okay, so if you have a horse though that is not comfortable enough to do that vigorous level of exercise, there's been some initial work looking at resistance bands, so they could work at like a lower pace but have to work a little bit harder. So if you have an animal that can walk comfortably but is not trotting or cantering, there may be a place for resistance band training and helping again activate and make them more insulin sensitive. So stay tuned for that too.
Okay. We are past time, but Dr. Manfredi, just really quickly, I'd like to touch on what should our owners do who are listening? Obviously, they're here because they're concerned about this. What should they do in an acute case of laminitis with their horses? What should their reaction be?
Sure. So for an acute case of like a endocrinopathic form of laminitis, some of the studies that we have done experimentally and then looking at clinical cases actually has shown that icing horses continuously and not on and off again, but keeping them in continuous ice has helped prevent the development or severity of some of the laminitic change. That in conjunction with the anti-inflammatories that Dr. Burns talked about before, either the flunixin or phenylbutazone. So for us, at least here, and Dr. Burns, you can comment there, getting these animals with icing their feet or their distal limbs has been an important step towards preventing further damage.
And Dr. Burns, did you have anything to add?
Absolutely. I think I certainly agree with that. And I'll just to comment on the ice, we also do a lot of continuous distal limb icing cryotherapy here, both for clinical cases and certainly for experimental work. And there's some recent evidence that, we've known for a while that icing is effective for sepsis-associated laminitis, but there's some new evidence coming out, and this has been a question for a while, that distal limb cryotherapy is also effective in both preventing, if it started early, and mitigating the severity if it started during a bout of endocrinopathic laminitis. And so it appears that icing is very effective in the setting of different forms of laminitis. And so I completely agree. We use a lot of ice around here, and horses seem to tolerate it very well. Some of our physician colleagues are sort of horrified when they see what kinds of temperatures we achieve in the distal limbs, because when they talk about cooling for therapy, they're talking about 4 or 5 degrees away from body temperature, and we're talking about 30 degrees away from body temperature. But horses tolerate it very well, and it seems to be really effective in the setting of this disease, which can be difficult to treat. So yeah, we do a lot of that too.
Okay. Well, the hour went by really fast. So unfortunately, that's all the time we have tonight for this topic. I want to thank Dr. Burns and Dr. Manfredi for joining us and for answering our questions tonight.
It was a great pleasure. Thank you very much for the invitation. It was a great pleasure.
Yes, thank you so much.
And also, I'd like to extend a thank you to our audience for submitting questions and for joining us tonight. And also a thank you to our sponsor, InsulinWise, made by KPP, for bringing this event to everyone for free. Please join us next month when we'll be talking about fly and insect control on your horse farms. Until then, from all of us at The Horse, have a great night.